The common theme that we see in pregnancy and postpartum, it's treated as a very fragile state. And while yes, there are some things that we have to be a little bit more careful about, strength is very, very protective, and there's a smart way to do it. Welcome to Rethinking Fitness during pregnancy and postpartum. My name is Dr. Jen Shan, and I'll be taking you through this journey with me. I'm gonna go through some common beliefs. Again, I'm a physical therapist here at Reload, and I've had a lot of opportunities to work with postoperative sports populations and also pregnant populations. And I always thought it was really odd how large the gap was for rehab, like traditional pelvic floor rehabilitation, and the sports rehab that I was providing. There is no time in an orthopedic setting that I, or literally anybody at Reload, would ever tell someone, your body's under more strain, stop using these muscles and let them decondition. This population is underprepared and underloaded. So just because you're pregnant doesn't mean that your needs and demands for healthy longevity are any different. The thing is that people that are more active have better outcomes after pregnancy and postpartum. The physical activity guidelines, if you don't already know, it's 150 minutes of moderate intensity aerobic exercise, and then also 2 days a week of progressive resistance training. And then also the third one that a lot of people forget is to limit sedentary time. It is dangerous to exercise while in the first trimester. 2 systematic reviews that were conducted in 2023. They both state that the answer to this belief is a resounding no. It is not associated with an increase in miscarriage. There were 13 randomized control trials, and all of them showed absolutely no correlation between miscarriage and exercise. Therefore, the conclusion is that exercise during pregnancy is beneficial and safe. Avoid intense exercise while pregnant because it can hurt the baby. We hear a lot about doing low intensity exercise, like stick to Pilates, stick to yoga, stuff like that, which all has its benefits for sure, but what about intense exercise like weightlifting, progressive overload? There's a lot of studies that look at vigorous exercise during pregnancy, and they used heart rate thresholds to measure the intensity level at which they were working at. And they also monitored fetal heart rate, and they also measured fetal perfusion in the umbilical cord, and they all had improved levels after exercise. So the findings were that baby's heart rate rises in parallel to mom's, and then it returns back to baseline post-exercise. And there's no sustained fetal distress or blood flow compromise. No crunches ever while pregnant. The belief is that it puts stress on the rectus abdominis, which is your six-pack muscles, and that it'll cause diastasis recti, which is the separation of the 2 ab muscles. The closest thing that actually relates to diastasis recti outcomes is having a weak rectus abdominis and obliques. This is what we need to train to have better outcomes. So if you can, and you have the means to, and you have the time, always try to go to a healthcare practitioner that knows you, that knows your history, that can give you specific recommendations for what is good for you specifically. Good training doesn't just look like a hard workout, it also looks like a good recovery, and find a coach that understands that.